Hi, my name is Susila Thapa. I am a family nurse practitioner student at Indiana State University. Today I am going to perform your physical examination. Is that okay with you?
Yes.
So today's physical examination includes I'm going to check your mental status, your general overview, your skin, in your head and neck, your eyes, ear, nose, and mouth. Okay? Is
Yeah.
that okay with you?
Yes.
Thank you so much. And I already got your vitals here with me, and your vitals looks okay. They are normal for your age. And I'm gonna start asking a couple of questions. Uh, do you mind to tell me your first and last name?
Sure. Stephen Michael.
Thank you so much. And how old are you?
I'm 40 years old.
Okay. And do you know where you ate?
Yeah, I'm in doctor's office right now.
And do you know which date is it?
Yeah, it's Monday.
Monday. That's perfect. And can you tell me who is the president of USA?
Yes, Joe Biden.
Yeah, that's perfect. Thank you so much for answering those. And I'm going to start with checking your skin. So I'm going to start from here, looking here. So what I am checking here, if you have any lesion, any jaundice, any masses, any itching, or any kind of skin alternation. What do you do? Do you work?
Yeah, I work in IT consulting company.
Okay, you like it?
Yes.
Decide. And do you have to go to office or you work from home?
I work from home.
Okay, how long have you been working with her?
Almost like 8 years now.
Okay. Can I take your lower leg too, please?
Yeah.
Okay. In between your toes to make sure that you don't have any kind of infection or any kind of. I can see here like a couple of old scar. So same thing on here. I don't see any rashes, any lesion, any mass, no jaundice, no bruises, no skin discoloration. Your skin color is light brown. I think it is perfect for ethnicity. I'm gonna check your back. So your skin is warm to touch, very clean, intact. Let's see, do you mind to stand up for me, please? I'm gonna
Sure.
see your back here, back legs here. Okay, your legs are perfect too, and no swelling and no edema. Thank you so much. You can have your seat back.
Yep.
So I'm gonna check your hair and to see that your hair distribution, any hair losses or any lesion or masses. So I'm gonna first check your hair. It's equally distributed. No hair loss. Your hair is very thick. But on the back side, I can see lots of gray hair. That's good. I don't see any lesion, any rashes, no dandruff. It looks clean. That's good. And I'm gonna palpate your head and let me know if that hurts, okay?
Yeah.
So I'm just here checking if you have any lumps, any kind of tenderness, depression, or any kind of masses or any injury here. Does that hurt?
No.
Perfect. So I'm gonna feel your temporal artery. So our temporal artery normally here on your both sides. I'm gonna feel them first. So both arteries, they are regular. They are pulsating fine. That's good. And I'm gonna listen them. I'm gonna start from here. I'm gonna listen them at least 3 seconds. Yeah, I can hear them perfectly fine. Same here, at least 3 seconds. Okay, that's fine. I listen your arteries. The both arteries are here, and I'm gonna check your temporal mandibular joint here. Can you open your mouth? Close it. Open it again for me. And can you move your mouth to your left side, tongue, and right side? Does that hurt?
Uh-huh.
Okay, so I didn't hear any crackle or any tenderness here. That's good. So now I'm gonna move to your, I'm gonna take your sinus. So I'm gonna take two sinus, one we call frontal sinus, it's here. So I'm gonna press it here and let me know if you feel any pain, okay?
Okay.
So that's the frontal sinus. I don't feel any pressure, any tenderness, or any. So here, do you feel pain?
No.
Okay, so that's your maxillary sinus. So I did not feel any pressure or tenderness there too. So those are perfectly fine. And I'm gonna move down to your neck now. So I'm gonna see this the overall the bag inside to make sure that you don't have any neck vein swollen, any bruises or any mess. That looks perfect. So whenever you are doing that, let me see your trachea. It's here, trachea in the midline, supple, and then I'm gonna put one finger here. Okay, so it need not deviate it to any side, so that's normal. I'm gonna feel your lymph node now. So I'm gonna start from here. That's submental, that's submandibular. In the same line, I'm gonna test tonsillar, and in front of your ear, that's the preauricular, and backside of your ear, that's the postauricular, and then here backside of your head, that's the occipital, and then I'm gonna feel here anterior superficial, and can you turn this way please for me? That's the superficial clavier, like superficial cervical, and here deep cervical, and same thing here, superficial cervical, and here deep chain cervical, and on the both here the supra clavier. Okay, I did not feel any lymph node swollen. That's good. No tender, no swollen, no masses. So I'm going to take your thyroid here. So normally, generally, I don't see any tenderness or any swollen or any masses there. So I'm going to push my finger down here. And can you swallow for me? Does that hurt?
No.
Okay, so when you swallow, I did not feel any tenderness, any masses there. So that's good. So you don't have any lymph node, any swollen lymph node, or you don't have any thyroid palpable, which is really good. Okay, so I'm now gonna move to your eyes now. For first, I'm gonna look your both eyes. They're symmetrical, and your eyeball, they're both in the central, and then your eyebrows, both symmetrical, they're thick, black color, and then equally distributed. Hair distribution is nice, and no lesion or no cross down there. So that's good. And I'm gonna move to your eyelid on the both side. They're symmetrical, and there is no any color changes like a yellowish, bluish, or any lesion or masses. That's good. And I'm gonna see your eyelashes here on the left side first. They are moist. I don't see any crossed, any redness, or any discharge or any masses on there. And the same thing, your eyelashes are moist, no discharge, no crossed, or no lesion. Can you see up? So your conjunctiva, both sides, they are pink, no jaundice, no redness, no discharge, and your sclera on both eyes, they are white, no redness, no discharge. Good. And I'm going to take your this side, we call it lacrimal gland. Here I don't see any kind of outside obstruction here, no masses, no, your eyes are not very teary or they're not dry. So that's perfect. Now I'm gonna do your inner eye. I'm gonna do your first. I'm gonna like use this light for your eyes. So I'm gonna turn this bright light off first. What I'm gonna do is I'm gonna put your light to your pupil here. Just look straight down there. Same thing here. So when I put the light to your pupil, they constrict, and then they are like your pupil size equal, and they constrict both sides equally. And then when I put a light to your pupil and when it constrict, then we call it that direct response. And then when I put a light again on your right eye and then your left eye pupil constrict, that's we call consensual response. It's the same thing. When I put this light here, then your left pupil constrict. So you have a direct response and consensual response, both response present, which is good. And now I'm gonna use this ophthalmoscope. So we use that to examine the patient eyes. So what I'm gonna do is, let me put this optic disk to 0 so I can do the more focus light. So what I'm gonna do is, I'm gonna hold this, I'm gonna stand at least 15 inches far from you. I'm gonna hold this ophthalmoscope with my right hand, and I'm gonna use my right eyes to see your right eye, okay? And then, but I'm gonna use my thumb, left thumb, just to give support to your eyes. And let me know if it's discomfortable, okay? So I'm gonna just like this here. Okay, so when I put the light to your pupil, I can see the orange, your pupil dilate, and I can see the orange color glow. So that we call it red reflex. So that's I see that on your right eye, which is normal. And on the left eye, I'm going to use the ophthalmoscope with my left hand, and I'm going to use my left eye, and then I'm going to see your left eye. But with my right thumb, I'm going to just hold your eyes like this, okay? So when we normally checking this, we normally try to use the 15-degree angle from your eye so you can see better. So that on these eyes too, when I put the light, I see the orange glow to your pupil. So that calls red reflex, which is normal. Then if the red reflex absence to some patient, that means the opacity of the lens, and that's normally present to the patient with cataract. So the eyes is done, and then I'm gonna move to, and then I'm gonna just feel your eyes orbital area. You know, they look fine. Just make sure that you don't have any kind of here orbital edema or any kind of masses or any pain there. Do you feel pain?
No.
So that's good. So that's all about the eyes. Put this over here. So I'm gonna move to your ears now. So first I'm gonna see the both ears here, to see the both ear. They look symmetrical, and I'm gonna just palpate here. I'm gonna just toss here and feel it. So I don't see any tenderness, any lump or any masses there, and your external canal looks clean, no swelling, no tenderness, no discharges, and no blockage. So I'm gonna pull this a little bit down there. Does that hurt?
No.
Okay, that's good. The same thing, I'm gonna just see it's a normal pinna on both left and right eye. And then your external canal looks clean, dry, and then there is no blockage and no discharge. Does that hurt when I pull it?
No.
So it doesn't hurt, that means normal. If it hurts, sometimes it's related to the ear infection, or sometimes it's our ear is related to the throat, and I mean connected to the throat and nose, so we can suspect that you have something going on. So now I'm gonna use this otoscope to see your inner ear. So I'm gonna just pull your ear up, backward, and little bit far. Okay, just let me know if that has to stop.
Yep.
Forward and little bit back, up, outward, and little bit back. Here, your inner canal looks very clean, no any foreign objects there, and no discharge, no redness, and your tympanic member looks very clean. It's a fairly shiny, and it's not bulging, no perforation, there is no scar mark. That looks good. I'm gonna do the ear here. So same thing. Here your left side ear, your ear canal looks, inner canal looks good, clean, no discharge, no redness, no swollen, and your tympanic member is very fairly shiny, and your tympanic member is not bulging or there is no perforation. There is a little wax there, but that's normal. So what I'm gonna do is now I'm gonna listen here. I'm gonna stand back here, and then I'm gonna press this ear. So what I'm gonna do here, I'm just testing your hearing. So I'm gonna press it, and then I'm standing at least 2 feet away from you, and then I'm gonna say 3 letters, that including numbers and words. So I'm gonna whisper it and let me know if you hear from your left ear. Okay?
5, 3, 3.
Yeah, that's perfect. And then I'm gonna do the same thing on this ear. I'm gonna stand far here, and I'm gonna repeat again same thing. I'm gonna say the 3 word including number and word. Okay?
6P8.
Okay. Yeah, you repeated from left and right. You hear perfectly fine. So that's you pass the hearing test. So suppose if this hearing test, if when I whisper and if you did not hear, or if you can't hear at least 3 words from ear, like both, that means that you have a hearing problem, and then I should have doing another test called Weber and Ryan test for the conductive and sensorial hearing loss. But since you passed the test, and I don't have to do the further test. Okay, so your hearing looks perfectly fine. So now I'm gonna move to your nose. First, I'm gonna see your outside of your nose. I don't see any masses here. No, there is no nasal crease. There is no redness, no swollen, or no tenderness. And then your nasal septum, it's in the middle. So that's good. And I'm gonna see your inner ears. So what I'm gonna do here, okay, your mucus pink, there is no polyp, no tenderness, no any masses, and no discharge. Same thing here, your mucus pink, no polyp, no swollen, there are not there's no redness or any discharges. That's good. Now I'm gonna move. Are you bored? We are almost
No,
done. So one
I'm
more
good.
thing. So I'm gonna move to your mouth, and first I'm gonna see your lip. Your lips are pink, and I don't see any crackle, no any blue discoloration, and then no any lesion, or no any crackles. Can you laugh for me? So your mouth looks symmetric. So I'm gonna see your. Let me turn the light a little bit back on here. Okay. So I'm gonna. Can you open your mouth for me? Okay. just checking your teeth here. Lower teeth. They are clean. I don't see any teeth decay, but looks like you have some refill there. And the upper teeth, they are clean. No teeth decay, but I see a couple of filling down there too. Can I see your tongue, please? Can you take your tongue out? So your tongue is moist pink. It's in the midline, and there is no any discoloration, no white patches, nothing there. That's normal. And then your floor of mouth, clean, moist pink, no white patches, no lesion, no swollen. Can you say ah?
Ah.
Okay, it's perfect. And I'm gonna use this. I don't have tongue depressor, but this is a clean. I'm gonna see your, we call it a mucal mucosa, just a side of your tongue. If you can move there. Okay, I don't see any white patches. It's moist pink, and there is no any alternation, no skin. Sorry, no any lesion, no redness, no bleeding. That's fine. So that's all for today's exam, and I did not see any abnormalities. So your skin dry, intact, no lesions, no bruises, but you have a couple of old scar marks there, but that's normal. And your nails, they were like without any sinuses, and you're without any clogging. You have a capillary refill less than 2 seconds, that's normal. And then I did not palpate any lymph node, that's good. I did not palpate your thyroid, that's good. Your eyes, I saw the red reflex, and I see that when I put the light, that both eye, the pupil, they were symmetrical, they were reactive to light, and your conjunctiva white, and your sclera, sorry, your conjunctiva pink. There is no jaundice, no discoloration, and your sclera white. I did not see any tear and any dry eyes, and I did not palpate your sinuses. So frontal maxillary sinus is normal, and your ear, you passed the hearing test. Your outer ear and inner ear looks fine. Your head, I did not find any abnormalities. Your hair looks okay. You have a couple of gray hair, but that's normal. I did not palpate any masses or anything. And then for mouth, I did not see anything. You have a couple of teeth refill. I didn't think your teeth filled, but that's normal. And I did not even feel a bad breath. That's good. Your mouth really looks clean, and then very hygienic. And then your nose, I did not find any polyp, any kind of discharges or any blockage there. So your nose mucus was pink, so that's good. And then all together, I did not find any abnormalities. Everything looks perfectly fine. Do you have any question or any concern for me?
No, I don't.
Oh, thank you so much for your time.
Thank you.
That's all for today's exam. Thank you so much for your time. I really appreciate your time.
I appreciate
you.
your help. Thank you.
Have a great day.
Bye bye.
Bye bye.